I'm Dr. Deeran. I've been a medical doctor for 14 years. I'm a GP. I have a special interest in skin, dermatology and women's health. But today I'm going to talk about all of the procedures, interventions that I've had done in the past, ones that I've liked, ones that I've not liked, what I continue to do. So let's get into it. Let's start with my skincare routine. So my typical morning skincare routine is starting off with a toner. I either use glycolic acid or niacinamide for my toner. I'll then go in with a peptide serum. The peptide serums that I love this one from Elizabeth Arden, and I also love the Medicate Advanced Liquid Peptides, and the Elizabeth Arden one is the one with hyaluronic acid, peptides and ceramides. So I'll use one of these and then I'll put on my sunscreen, and that's my morning skincare routine. Then for the evening, I put tretinoin onto clean, dry skin. Then I'll put on a peptide serum or cream again. If I'm going with a cream for extra moisture, I'll go with the Relife Defense Peptide Cream, and that has added hyaluronic acid as well. And then, even though you don't really have to, I go in with an extra moisturizer. I use the CeraVe Moisturizing Cream with hyaluronic acid. So that's my typical nighttime skincare routine. Next is devices. I use my red light mask about 3 times a week. I absolutely love this. I just find it something that's really easy to incorporate into my routine. And I also use a red light helmet, and I use that about 5 or 6 times a week because it's really easy to just put it on. I do my emails in the morning, red light helmet is on. And I think, we don't think about hair a lot in terms of our healthy aging interventions. So I'm really working on my hair at the moment. That's why I'm giving my hair a little bit of a rest from highlights, but I will go back to my highlights eventually. But I'm working on trying to get my hair to be the healthiest it can be. So red light is a part of that. Another device I have is the SkinPen microneedling device. You can get this SkinPen procedure done in most aesthetic clinics. It can only be operated by doctors, nurses or estheticians. It is a great procedure, but I don't really use it because it's kind of a whole thing. Like, you have to numb your face, then you have to sterilize your face, then your face is bleeding, then you can't use skincare for 24 hours, then your face is red for a few days. So it's lovely, it's great, but I just don't use it. I haven't used it. I would say I probably maybe used it like 6 months ago. So I just don't use it frequently for that reason. It's kind of a whole thing, and I just don't really want to commit to that whole thing like very frequently. In terms of my supplement routine for my hair, skin and nails, I take collagen and CoQ10. CoQ10 is a powerful antioxidant, so protects against oxidative stress, so can reduce the appearance of fine lines and wrinkles. I think it's an underrated one in terms of skincare supplements. Then for my hair, I take zinc and folic acid, which can help with healthy hair growth. The only injectable I do is Botox. I get it around my eyes and my forehead, and sometimes I get a lip flip as well. It can really help with volume of the lip, and the reason that I do that is that I don't want to get filler, and that's just a really personal thing for me about filler, and I can do a part 2 on that maybe another time. But the lip flip can help with volume of the lip. I think you can get it in your lower lip as well, but I typically just get it in my upper lip. And it can relax the tension in your upper lip, giving it a fuller appearance. Injectables that I've done in the past that I don't continue to do include Profhilo. Now, you get gorgeous results with Profhilo. It's very expensive and you have to keep it up. So for me at the moment, I'm not regularly doing it. It is a great treatment. I haven't done it in a while. It is nice, but it's just very expensive, so it's hard to make it sustainable. The other thing that I have done in the past is the Vampire Facial or PRP, and I don't think I'm ever going to do that again. It's just, everyone is different what they want to do, but there's blood in your face, you have to wash blood out of your hair. It's really extreme. I did it, and yes, the results were really nice, I have to say. So it's a great way to rejuvenate the face. And if you're looking to do something that isn't like a traditional injectable, it's wonderful. But for me, I don't think I'm going to do it again. Obviously, we never say never, but for me, I did it, the results were good, but I probably won't go back to it. I just don't really feel like I have the bandwidth to go to a lot of appointments. So I scaled appointments back hugely. Like, I used to get my hair highlighted like every 6 weeks. I used to get it washed every week. I had hair extension appointments. My hair extensions are out now. I used to get laser very frequently. And I just am enjoying the break from that kind of juggernaut of appointments. So I'm not going to a lot of appointments at the moment. It's basically my hair, which I will get back to my highlights, and my Botox. When I have more bandwidth, laser will be the first thing that I add back in, because laser is excellent and it's a major part of my routine I feel that is missing at the moment. So I'll either do, IPL, BBL or Fraxel. Maybe this is super boring. I'm not doing anything that innovative or exciting. Really, I haven't done exosomes or polynucleotides, and they're all lovely treatments. And you know what? If I had somebody in my basement running an aesthetic clinic and they would offer treatments for free, I would definitely do laser frequently if it was free and in my house. And same for Profhilo, if it was free and done in my basement. If I had a slimming spa, the way Paris Hilton has a slimming spa, have you seen it? It's amazing. Then I would definitely add back in laser and Profhilo. But I don't think I'm ever going to have, I will never have a slimming spa in my basement.